Good afternoon. Welcome to the Thriving and Healthy Kids. We all have a role to play in promoting positive childhood experiences. I am Jennifer with the CBLCC and welcome you today. We do have interpretation available for everyone who will be listening in English. Please click on at the bottom of your screen. It says interpretation. Please choose English. Otherwise, you can choose Chinese, Spanish, and Arabic. We also have captions available. If you click on you can view the live captions by clicking on the menu arrow next to the closed caption button. You can choose from showing subtitles, a full transcript, or both. You can also adjust the captions if you wish, and you can also hide the subtitles if you do not wish to see the text. If you do need any sort of technical assistance, please send a message you can do it through the chat to the host and panelist, and we will work with you to address any of your technical issues. We are recording this, and it will be available on the ACF Behavioral Health webpage. I will now go ahead and turn it over to Dr. Cohen.
Great. Good afternoon, everyone. And I love that we're starting this event with so many positive vibes of thumbs up and hearts. I love that. So back at you, that we are trying to make sure that this is going to be a great conversation that everyone can access. So I'm Dr. Mandy Cohen. I'm the director of the Centers for Disease Control and Prevention. And I'm so glad to be here with you to discuss one of our top priorities at the CDC for 2024, which is supporting young families. We want to welcome everyone to today's event and learn about how we can work together to promote positive childhood experiences for children and prevent adverse childhood experiences. Today's discussion is particularly timely because, as many of you know, April is National Child Abuse Prevention Month, and I want to recognize all of you on this call and in the audience for your efforts to protect children. That is such an important and hard job, so thank you for everything you're doing. I also want to thank the many folks you're going to hear from over the course of this hour. First and foremost is Jeff Hill, who is the administrator of the Administration of Children and Families, ACF. So thanks, Jeff, for co-hosting this together. This is a team sport, and I love seeing the collaboration across CDC and ACF. And then for our partners outside of government, thank you, Dr. Sandy Chung from the American Academy of Pediatrics, Dr. Melissa Merrick from Prevent Child Abuse America, who does fantastic work, and to some of our parent experts that I'm thrilled for you to get to hear from today, Valerie Frost and Paula Bibb Samuel. Thank you all for participating in this conversation. So we're all here today because all children deserve to have a safe, stable, nurturing relationships and environments so that they can grow and learn and thrive. And so before I begin, just a level set on definitions here. What are we talking about when we say fostering positive childhood experiences and preventing adverse childhood experiences? So positive childhood experiences are one where in a child's life gives them a foundation of safety, stability, and bonding. And in general, those are things like having trusting relationships with parents or peers or other adults, and having a stable, safe home, school, and community environment, and having the opportunity for growth and fun. Positive childhood experiences, we know, are related to improved health and life opportunities. On the other side of the coin, adverse childhood experiences are potentially traumatic experiences that can happen in a child's life, including having a family member with mental health challenges, or who are divorced or separated, or witnessing or experiencing violence. And disproportionately, these adverse childhood experiences unfortunately impact our communities of color. Adverse childhood experiences are linked to many negative outcomes: poor mental health, substance use disorder, chronic health problems, some infectious diseases even, and violence in adolescence and adulthood. They can also negatively impact education, job opportunities, and earning potential. And unfortunately, adverse childhood experiences are common. Over half of adults have at least one adverse childhood experience. So how do we think about prevention and also resilience through those adverse childhood experiences? So I'm excited to talk about what we know and how we can do more in this space for promoting positive childhood experiences and, again, preventing the adverse childhood experiences, again, so we can be protecting health and improving lives from childhood through adulthood. And we all have a role to play here. Let me tell you a bit more about how CDC is thinking about this. Again, one of our priorities being supporting young families this year, and this is very central to that work. It's how to keep kids healthy and prevent bad outcomes so children and families have what they need to thrive. You know, and the way CDC shows up and comes to the table with this is in our expertise and also in our investments. So on the expertise side, you may know that CDC put together a resources for action around preventing adverse childhood experiences. And I think maybe Phyllis is going to put that in the chat for you. Okay, thank you. Well coordinated. Thank you, Phyllis. Together, we put together resources of what we know works, and how we can then work with state and communities to put things into action. One of them is happening right now with sharing that action guide, making sure you know what we know based on our evaluation and expertise. So for example, we know that early childhood home visitation supports young families and improves many health outcomes for children and their families in the long term. Georgia is working to increase access to home visitations through programs like Healthy Families with funding from the CDC. And that takes us to bucket 2 of where CDC works here is in investments. This is where CDC also gives resources to communities to collect their own data to be able to better understand what's happening with children and families. I was just in Chickasaw Nation in Oklahoma, and was talking with the folks who are receiving CDC funding to do exactly that, which is to collect data on adverse childhood experiences and positive childhood experiences to inform how evidence-based strategies might be working in their communities. So we just want you to know, priority for CDC. It's why we wanted to co-host this with Jeff and team at ACF. It's an important public health issue that impacts health immediately in childhood, but into adulthood. And we have tools to know what works in that action guide. And we also need to build evidence around how do we make sure we're doing more of this, particularly in partnership with many different kinds of sectors, like the education sector and others. So this is really important work, and preventing adversity and promoting healthy childhood is a team sport, which is why I'm excited to turn it over to our co-host, Jeff Hild. I unfortunately can't stay with you for the full hour, but you'll be you're going to hear from all the experts, and I'm leaving you in good hands with my Director of Health Strategy, Dr. Charlene Wong, who is really the driver behind this and frankly the expert, so you're getting the best. So Jeff, over to you for the rest of the conversation. Thanks so much, everyone.
Well, thank you so much, Dr. Cohen, and thanks for all you do to keep our country healthy, and welcome to everyone on the webinar today. I'm so glad to be partnering with Mandy's team at CDC. I'm so glad she said this is a team sport that is so on the mark, and we all clearly have a role to play in this work. My name is Jeff Hild. I use he, him, his pronouns, and I have the privilege of leading the administration of Children and Families, or ACF, which, like the CDC, is part of the larger Health and Human Services family. I'm also the father of an amazing 9-year-old with autism, and even coming from a very privileged background, I've had to navigate systems that seem needlessly adversarial or not family friendly to get my daughter the support she needs. And so I always bring that perspective of a parent into these conversations as well. And I should let you all know that I'm coming to you today from Anchorage, Alaska, where we're visiting some of our grantees up here. And if I look out to my left at the hotel, I can see the beautiful snow-covered Chugach Mountains. So winter is not done with Alaska quite quite yet. So I'm really biased, but I think ACF has one of the best missions in the federal government. We work to promote the economic and social well-being of children, families, and communities all across this country. And we do this work through programs and initiatives, including child welfare, child support, temporary assistance for needy families, Head Start, childcare, energy assistance, support for refugees and other new Americans, and prevention of intimate partner violence and human trafficking, among many other things. And at ACF, we believe that every community can be resilient, that every family should have economic security, and that every child should thrive. So thank you all for being here. I see 1,600 folks on the line now. I think we had several hundred who signed up to get a recording of this. So people vote with their feet or with their mice or whatever we call this in the digital virtual age to get this information. So this tells me we're on to something important here. We've heard from lots of parents, lots of caregivers, and lots of families and partners caring for and working with families that they want to be empowered with more information and resources to support the children in their homes, in schools, and communities. And families, providers, and communities want to know what support is available and how they can access it. And they want resources that are relevant to their culture, language, and community. And so that's what we're really excited to be sharing with you today. And as Dr. Cohen noted, right, the science is really clear here that preventing ACEs and promoting positive childhood experiences greatly improves long-term health outcomes. And we know what works, right? And we also acknowledge at ACF and in other federal agencies that we can and must do more to prevent and mitigate the risk of experiencing ACEs by promoting positive childhood experiences in early childhood, starting with the very youngest kids. And we believe we can help build communities and families that can not only bounce back, but bounce forward in the face of adversity. And so at ACF, we take a whole family approach to this work because we know families do not experience crises or hardships in isolation. And we also know families benefit from community supports and healthcare and likely participate in our programs alongside other agencies and community programs. And so we're working together on how we can reduce barriers to participation, increase cross-sector collaboration, and engage in opportunities like today to ensure families and communities have the information and the resources they need. And Mandy also touched on this a bit, but we also recognize the historic and place and race-based disparities that have often been based in policy choices that have meant that some communities, particularly Black and Brown communities, have borne a disproportionate burden of adverse childhood experiences. And so in our work, we center equity in everything we do and work to intentionally break down barriers to create equal access to our programs. And ACF is really proud to support National Child Abuse Prevention Month. And I think as folks know, the theme this year is doing things differently. And one way ACF is working to do things differently for children, youth, and families is to continuously improve and expand our work to authentically partner with people with lived experience, to share power and identify opportunities to improve program and policy to more equitably meet the needs of families and communities. And so we're incredibly fortunate to have amazing partners in this work, including so many of you on the webinar today. And thank you to the American Academy of Pediatrics and Prevent Child Abuse America for your great partnership. And we're really honored to have parent advocates Valerie Frost and Paula Bibb Samuels to contribute their wisdom, their vision, and leadership in the development and hosting of this event. We're so grateful for your partnership and looking forward to hearing from both of you shortly. So whether you're joining us today as a professional, as a community member, as a parent or caregiver, we hope this is really valuable. And as we said at the top, we think everyone has a role to play in promoting positive childhood experiences and preventing adverse childhood experiences. So our goals today are pretty straightforward. One, that everyone leaves with at least one new idea for what they can do to promote positive childhood experiences and prevent ACEs in their own work and in their own communities. And two, that you know where to find more information about so many of the evidence-based strategies and resources that Dr. Cohen spoke about at the outset. So we designed this event to be a conversation. We've got an impressive group of panelists, and so now I'm delighted to welcome all of them onto the screen, and we'll dive in to our conversation. So first, and I see you, Paula, I want to introduce everyone to Paula Bibbs-Samuels. Paula is coming to us from the great state of Texas, where she tells me it is virtually summertime there. Paula brings 20 years of parent leadership in this work. And so Paula, I want to open the floor up to you. And could you tell us a little bit more about yourself and why you think this conversation today is so important?
Thank you so much, Jeff. Yes, I'm from the great state of Texas, and we do everything bigger in Texas. I am a parent, I'm a former kinship provider, and I am an advocate for children and families. And as Jeff said, I've done this for over 20 years. I will continue to do this work because every person involved in child welfare deserves a voice. I can and will be that voice. This conversation is important because children are important. Families are important, and experiences shape our lives and often affect our outlook on life. Though adverse childhood experiences affect the lives of children, these experiences do not have to be deterministic. It doesn't mean that a person who has experienced adverse childhood experiences will automatically suffer throughout the entirety of their life. Promoting positive childhood experiences can look different depending on the community and the culture. Let's consider the term experience. Some experience hunger, some lack of shelter, some financial instabilities, while others experience wealth, safety, and abundance. Each of these experiences will affect them. However, how they affect them depends on the rest of the story. So communities should reinforce positivity within the culture, within the home, and the community. Some may not have the same needs. Consider this. What could be a negative or adverse experience for one could be made positive for another. You don't believe it? Let me tell you. I have a story. Once when I was younger, my lights got cut off because I failed to pay the bill. I had the money, but I didn't pay it in time. And this was before everything was online. So my two children and myself, we were in the dark. A negative experience, right? Well, let me tell you, I instituted an indoor camping event. We made tents from sheets, and we use flashlights to go anywhere in the home. My children absolutely love this, and we continued this now tradition until they moved out of the home. We still talk about this positive experience with camping. So what could have been a bad, negative, or adverse experience turned into a positive, lifelong memory. There are so many different resources that would help promote positive childhood experiences. The key is making resources available, accessible, and known, because no resource will help a family if the person in need doesn't know that they're there. Thank you so very much, Jeff.
Thank you so much, Paula. I'm going to take some of that Paula Texas energy, bottle it up, and hold it with me today. And I love the camping story, and I think that illustrates how we can turn this conversation kind of on its head and take a strengths-based approach. So thank you so much, Paula. So now I'd like to turn to Dr. Melissa Merrick. Melissa is the president and CEO of Prevent Child Abuse America. Melissa, welcome to the conversation. I'll let you introduce yourself and share some of the insights from your vantage point of working with communities all across the country about why you think today's conversation is so important.
Thanks, Jeff, and hi, everyone. The 1,700 people that got to experience that high energy and super important contribution that Paula just shared with all of us. It sent chills through my whole body. I think this is super important because the truth is that prevention is possible, right? And we want to maximize that possibility, but we can only do prevention, true prevention action, in partnership. And that's partnership with the tremendous partners that we have on the call today, CDC, ACF, our parent leaders, the American Academy of Pediatrics, and of course, our PCA America network. I know that many of the 1,700 are our state chapters and Healthy Families America sites. You all have been texting me and telling me you were so excited for this conversation. And it's because we need these partnerships to elevate that collective vision that we all have, right? I've heard already that prevention is a team sport. Absolutely. We've heard already that one of the themes, right, about doing things differently at PCA America during Child Abuse Prevention Month, our theme is building hopeful futures together. I mean, all of these things are palpable in this virtual space today, because ultimately we are trying to aspire to a collective vision that all children and families are thriving, right? They're all happy and healthy and supported and nurtured, and that they can live a purposeful and happy life with home for the future, right? We have a tagline at PCA America that says childhood lasts a lifetime. So how do we have all those good things for children and families and communities to stay with them across the life course, right? We want to make sure that all families have what they need when they need it, delivered in their own communities with love and trust and respect without stigma. And we want this before families are in crisis. This requires to do things differently. This requires a shift, not just in our thinking, but in our narrative, right? Not waiting for families to be in crisis to get services and supports that are accessible, available, right? Trustworthy before they're in crisis. These supports can keep them healthy and thriving. That's what we mean at PCA America about primary prevention, right? How do we stop child abuse and neglect and other ACEs, other early adversity before they can begin? But of course, we need a full prevention continuum. We want to change trajectories for families once adversity has occurred. And like Paula said, and Jeff said, and everyone's going to say, prevention is possible and we know what works. So how do we elevate those strategies together? How do we center families and the power of families knowing what they need, right? We don't know. It doesn't matter that we have fancy degrees or we have more money or we have more power. We don't know. We have to listen. We have to listen and co-create these solutions. And, I just have to say, this is why PCA America is a special partner. We have state chapters around the country, including PCA North Carolina, where Drs. Wong and Cohen were before, PCA Alaska, where Jeff is currently. We also have an evidence-based home visiting program, Healthy Families America, all over the country that we know are an integral part of the prevention continuum and really help us to create a primary prevention ecosystem in this country that does not yet exist, but we know that together we can really aspire to that collective vision. Again, prevention is possible. We want to maximize that possibility. We can only do it in partnership. So thanks so much for having me today. I pass it back over to you, Jeff.
Thank you, Melissa, and thank you for, I think, challenging us to think about how we shift the narrative and really how we center the power of families. And thanks for everything that PCA does. So now I'd like to welcome Valerie Frost to the conversation. Valerie is a parent advocate and strategic initiatives associate at Kentucky Youth Advocates. Valerie, I'd love to welcome your perspective to this conversation. And really what you think about including resources that families and communities need to make this, I think, more than a conversation and really turn some of these resources into action. So Valerie, take it away.
All right. Thank you, Jeff. And I just want to thank the panel hosts for having me today and the panelists for joining. I'm also, like Mandy, I love the energy, all the reactions here popping up. It's a great call and this is a great cause. So once again, my name is Valerie Frost. I work for Kentucky Youth Advocates. We are an independent nonprofit children's advocacy organization in Kentucky. So I personally wear many hats, but you can see little drawings back here. Most important role is being a mother of 3. And so why I think this conversation is important, just like Paula, children, we're talking about children. Children are important. And we're talking about really those early childhood experiences that shape a whole entire person's life and then just really lay that critical foundation. So I am a parent. I'm also a parent that has experience with child welfare involvement. And so you might have heard the term lived experience, lived expert. This is getting a lot of attention now as something that's possibly unique, but really we all have lived experience. I really loved Jeff shared that he has lived experience as a father of a child that is autistic. I also have an autistic child, and these experiences, good, bad, adverse, positive, they just make us human. We're human beings. We're parents. We're connecting on this call and we can connect with others. So it's really not deterministic in a way of saying that because you have adverse childhood experiences, now that the foundation is destroyed, these are opportunities for support. They're opportunities for the community to come in and provide more of that positivity. And that's why I really love just having parent advocates on this call, because we can connect and relate to others and provide those answers that Melissa was referencing, that maybe the experts per se don't have all the answers, but parents do, community does. And so I love the intentionality on this call of having parents and parent voice here. So as far as the community and what types of resources would bring that positivity, I want to go back also to what Mr. Jeff said about barriers. So we know that positive childhood experiences are not equitably available to all. And so we want to break those barriers by thinking of what can I do to increase access to this positivity. So for example, summer is right around the corner. My kids, I got a note about t-shirts for field day. That means we're almost up here. And so summertime is camp. Not everybody can afford that. So thinking about costs, transportation, can we have scholarships for different things, even just enriching experiences. A lot of families are going to go on vacation this summer. So providing free, low cost attractions, tickets, these are the ways to provide diverse and enriching opportunities on top of, love Paula's example of parental resilience and stepping in. So we want to provide a lot of examples of what can we just do on a day-to-day, but also how can we offer things that may be a luxury or may be easier for someone to access than someone else. And that's just a way to ensure that everyone in the community can have that positivity.
Thank you so much, Valerie. And I think you win the award for best artwork in your virtual background, and really appreciate you pointing out that some of the challenges we're talking about today are really opportunities, and we take advantage of those by harnessing the power of connections with parents and communities. And thanks for grounding us in some specific examples of what that looks like. So now I want to bring into the conversation Dr. Sandy Chung. She is the former president of the American Academy of Pediatrics. Dr. Chung, we'd love to hear from you about how communities can look at the question of positive childhood experiences through a medical lens, and your perspective on why this conversation is important.
Great. Thank you so much for having me. And hello, everybody. I'm Dr. Sandy Chung, as he mentioned, immediate past president of the American Academy of Pediatrics. I'm a pediatrician in Virginia, and most importantly, I'm the mother of 4 children. I'm honored to be here with you today to talk about how positive childhood experiences can support healthy child development. And as already discussed, evidence supports strategies to promote safe, stable, nurturing relationships to lessen those immediate and long-term harms from trauma. As a child of immigrants, I grew up in poverty and wholeheartedly agree with Paula that adverse childhood events do not have to be deterministic, and exposure to positive childhood experiences can build resilience and change the life course of a child. Pediatricians and pediatric healthcare providers, we see children early and often, and we have the greatest potential to identify trauma in children early, promote recovery, and build resilience to support healthy mental and emotional health development. For example, recently there was a family in my practice with a 3-year-old and a 5-year-old, and unfortunately they lost their home. The children were, not surprisingly, having sleep and behavioral issues, so they came to see us, their pediatrician, for help. And knowing that these behaviors were likely manifestations of the trauma and uncertainty in their lives, I was able to work with the parents to help develop strategies to help the children feel safer and more secure. The parents went back and worked to ensure that their children's routines remained as close as possible to their usual schedules, even though they weren't in their home. And then in a follow-up appointment a month later, the parents reported that their children's behavior and sleep were so much better. That safe, stable, supportive relationship between the parents and their children was essential to improving outcomes. Trauma-informed care is fundamentally relational healthcare. In the American Academy of Pediatrics, we've been working hard to support pediatricians and pediatric health providers in this approach with all children and families. We support the development and maintenance of safe, stable, nurturing relationships using a strengths-based relational health framework. I'm thrilled to say that with the support from the CDC, the American Academy of Pediatrics is building a foundation for a national center on relational health and trauma-informed care. This center will help us redefine pediatric care to promote optimal health for children by ensuring that pediatricians, that we have the training and support we need to help you and families promote this vibrant relational health that we all need. And then by focusing on relationships that pediatricians and pediatric healthcare providers have with patients and our families, we can give the care and help make those connections to community resources to help mitigate risk factors that threaten those healthy relationships. Thank you so much for the opportunity to share some of this information, and I look forward to more conversation.
Thank you so much, Sandy, and thanks for everything that AAP is doing in this space. So I'd now like to invite all the panelists back up to the virtual stage. We've heard from a range of perspectives really about the urgency of this topic. And Valerie, Paula, and Charlene, I'd love to hear from you all about what does it mean when we say that everyone has a role to play in supporting families, and what does that look like in your communities or in your work?
The idea of community tells me that we're in this together. So what does that look like? It looks like help. It looks like support. It looks like extending a helping hand and not a judgmental voice. It looks like programming that teach, encourage, and improve the lives of children and families. So understand that this isn't just paying the bill, but possibly improved internet services, libraries that have current publications, accessible and reliable transportation. And it also could be varying opportunities to experience life outside of the home. That goes back to what Valerie talked about with camping and summer camps and things of that nature. So it looks like traveling outside of the neighborhood to see a different life. And this requires a network of support and an entire community.
Thanks, Paula. All right, so I'm going to jump in here. I'm just going to tell you all about today. When we talk about everyone having a role. So I woke up this morning, I got the kids on the bus. So there's the bus driver we interacted with. I got the baby to daycare. There's the person at the front desk that let us in. There's the daycare teacher. I got home, just a confession, locked myself out, had to call Papa Lock. There you go. Make sure a mom can be successful, get to work on time. Then I went to the post office, interacted with the postal worker. There are so many people that our family interacts with in one day. And it takes every single person, because at every single touch point that we have with someone in the community, whether it's our neighbor, whether it's the teachers, whether it's getting coffee before work or after or whatever, all of them can add positivity to our day or be a barrier. So it really does take all of us, and it takes everyone knowing and feeling responsible and knowing what role they play. And it doesn't have to be like a monetary role. It could really just be smiling and saying, hi, how are you? You know, sending someone off with a positive message. Maybe stepping in. We're at the grocery store. This is always going to be my go-to. This is an eternal dilemma. I have 3 kids. I have 1 car, 1 me. Please take my cart. Please bring my cart back to the return thing. That is so helpful. But really just every single person feeling responsible and not waiting for someone else to do it. If you see an opportunity, that means you saw it for a reason, and that's you.
Thank you so much, Paula and Valerie. And let me just reintroduce myself, Charlene Wong. As Mandy mentioned, I'm her senior advisor for health strategy. I'm also a pediatrician like Sandy, and so we've had the chance to do some wonderful work together on behalf of children. And most importantly, like so many others have introduced themselves, I'm also a parent. I'm a mom of 2 wonderful girls, and I'm just really that they are the reason that I get up every day and do the things I do and focus on kids and families in so much of my work. So Jeff, to your question, as we've all been saying at CDC, we believe everyone has a role to play. You heard Mandy say, we talk about team sport all the time. And Valerie, I love how you just walked through your day. I think about the same thing, right? Like, who are the people that are in our life each day that are impacting me, kids, my husband, the family, our broader family? The grandparents are actually here right now, right? And so it's extended family, it's our teachers, it's their coaches, and their sports teams and things like that, who are all have really important roles they can play. Now, what I love is today we've already been giving so many specific tips, and Jeff, you laid that out. That's one of our key goals today. We want everyone to walk away with at least one thing. And Valerie and Paul, I feel like you just in your answers there gave like 5 different things. I also want to share that we have trainings on our website. It's called Veto Violence, and Phyllis is going to drop that link in the chat. And this is again, Jeff, another goal you said is if you want more information, right? If you want to become a super user expert, or even just get a couple more ideas, this is one of these websites you can go to and learn even more about what role you can play in your communities to promote healthy childhoods. I'll just go back to what Mandy started with, right? We know what works. She talked about some of the resources already. I also want to point out that we have a resource that we created together for this event. It's about how we can make a difference together, and it has so many of these specific tips and ideas that each and every one of us can put into action now. I'll give you one example as we put the link for that resource flyer in the chat. And it's called Playful Parenting. And it's about, how can you, in your busy lives, as you're, Valerie, carting your like multiple kids around, getting to the grocery store and the post office, in that time, you're trying to get them showered and to bed and all the things. Even taking 10 to 15 minutes out of the day, and this is something I continue to do with my kids to this day, and let them know and make it very clear, this is this time that's about them. My attention is on you. When they were younger, we would call it like their special playtime, and they get to choose their toy and we do a thing. Now that they're a little older, they're in elementary school, it's what do you want to talk about, right? And they let them choose a topic, and for 10, 15 minutes, I don't have my phones out, don't have my computer out, but it's just focused on them. And it's moments like that that can really be these things that help promote these positive childhood experiences that we're talking about. So I love how there's so many examples today, just to make the point, they don't need to be huge things, right? Sometimes they can be, but they can even be these little things that are a few minutes out of your day. Sometimes even a few seconds, that smile, like you said, Valerie, putting the cart back. Thanks so much, Jeff. So now I think I actually get to ask the next question. Melissa and Valerie, would love to hear from you all about how communities from across the US can work together. I think this is a theme today, to prevent adverse childhood experiences, promote those positive childhood experiences. And let's keep going on that theme. What's a concrete thing people can do today or by the end of the week to promote positive childhood experiences?
Yeah, I love this question, and I love the flow here, that it's really in the tiniest moments that prevention happens, right? It's in these, like, it builds to really big, and I'm going to talk about some big P policy changes and other things, but really it's in these tiniest moments where we are able to de-stress and access the best parts of our brain, take the load off so that we can bring our best selves to this job of parenting collectively, right? And so I said it before, listening to families, right? Centering families as the expert, as the key decision maker, right? Elevating their voices like we're doing today is critical, right? And it's not just, here's the kicker, it's not just listening, it's listening with humility, not like listening for the answer that we want, but listening with humility to families and believing them. Okay, I just think that this is critical. It's not like listening to them to check a box. It's listening to see how does that inform our advocacy on the Hill? How does that inform how we're going to work across our communities and our state chapters to advocate for policy solutions, right? That's that big P, right? Those safe, stable, nurturing relationships, and environments. We also mean a socio-political environment. So when I listen to families with humility, I hear things like economic stability, right? Strategies that take the economic edge off of families, right? Access to mental health support, again, on the front end, right? And throughout the lifespan. I hear things like early childhood supports, childcare, right? Things like this, these concrete things. So I think if we all are able to just listen, but listen really, truly in a very present way to families, wow, we're going to have a whole list of solutions to co-design together and to co-create together.
Thanks, Melissa. So I'm repeating everything that everyone has said. We're doing this together. And so I personally would like to see all community entities, whether that is just an average community member, a neighbor, a leader, a service provider, really to see how interconnected everyone is. You may not see the rest of my day, but if you are the bus driver, know that you are one piece of all the people, and every single one can either be a gap or filling and connection there. So I'm going to go back. I'll give another example. I'm going to reference the post office a lot. And if there is a prevention award, Melissa, I will give it to my local post office. And I'll tell you why here in this example. And if some of you all don't use the mail and you're not old fashioned like me, sorry, I do still. I'm a big enthusiast of snail mail. At this time, but I do regularly go to the post office, and I do have 3 kids. My kids are also 6 years and under, and I have twins and a toddler. So I'm in like deep in parenting right now. But they have this spinning greeting card rack there, which is very distracting to children. And the first couple of times you could see, I'm trying to fill out these labels, and it's a moment. But I was able to connect with the postal worker. She noticed me as a parent. And so the next time we came in, she brought in children's books with her, anticipating that I was going to come back sometime that week, and actually sat down and read a story to my children. And so she is prepared for me and knows that I will be in sometime soon. So my suggestion really is just to notice parents in their very real moments. And like Paula said, without judging, and take that responsibility and do something as small, low cost, or big. But yeah, just to take that responsibility and notice and connect.
Thank you so much. Sandy, I'd love to ask you a question. As a fellow pediatrician, we know a lot about the impact of positive childhood experiences and the benefits on children's health. Would love to hear a little bit more about some of those benefits, and what should clinicians, people who are working directly with parents and caregivers and children, how should it be that they're working with parents and caregivers and families to really support children and families' well-being?
Yeah, thanks for that question, Charlene. And, I think what's important for us to all know is that the science supports all of this, right? The science supports that positive childhood experiences and the healthy relationships with caregivers that we've been talking about, all promote vital child health development, right? We know with early childhood brain development that so much of early childhood brain development results in your long-term adult health outcome. And so it's so important that early on that a child experiences positive experiences as early as possible. But it's also never too late. I think that's also important to know that if you've got children, I have teenagers and young adults at home, and I know that I will continue to develop those positive childhood experiences well past when they think they're children. They're always my children. So physicians and other health professionals, we're key to this work. Pediatricians, our relationships with our patients and our families give us that opportunity to support those healthy relationships. And especially if the parents themselves may have experienced trauma or other experiences that make it harder for them. When we're giving advice and working with parents and children, I think it's important for us to build on the strengths of all the adults we're working with. As a pediatrician, we love working with kids, but we spend a lot of our time primarily working with those who care for them. And as we've heard today, even those small amounts of positivity can help build resilience in children. Pediatricians and other healthcare providers, we can be great partners and to help families find those resources and learn skills. So if you're in an organization where a pediatrician or a clinician who works with children isn't a part of the work that you do, feel free to reach out to us. We very much want to be involved, and we'd love to be a part of all the work that you're doing and to make sure that, you all are a part of all the work that we're doing so that we continue to build on that team that we've talked about so much today. So thank you so much.
Thank you, Sandy. Charlene, I want to dive a little deeper into the federal perspective here, which I think you touched on a bit earlier about some of the great work CDC is doing. But what's your perspective on how those of us in federal agencies can promote environments where all children and young families thrive? And what are some of the ways that CDC is partnering with states and local communities to promote prevention?
Yeah, thanks so much for that question, Jeff. Let me mention three things. I think first, like I've mentioned before, there's a lot of resources about how we are supporting professionals, parents, all the people that we have mentioned today that have a role in supporting young families. And so again, I'll mention that Veto Violence website. Perhaps we can redrop that chat or that link in the chat. So folks who want to go learn more. Specifically, I think many of us have mentioned our role as parents and how important we know that parents and caregivers are in the front lines day and night. We actually have a new webpage at CDC. It's cdc.gov/parents, and we'll put that link in the chat as well. And again, these are more resources for parents who are looking for additional ideas. We have some that are focused more on parents of younger children. So we call that our essentials for parenting toddlers and preschoolers. And then I'm actually a specialist in adolescent and young adult medicine. And of course, we talk to our teens differently than we talk to our toddlers. And so we have essentials for parenting teens resources as well. And one, again, I want to give a specific example of a type of tip that you would find in there. It's things like looking for opportunities to praise your child and teen. And no matter if they're young or old, one way that you can make that praise even more meaningful is to be specific, right? What exactly was it that you observed about them that you liked seeing, or that you liked hearing the way that they used their please and thank you, or the way that they helped put their things away in their room without you needing to ask, right? Calling that out and praising them, that in and of itself is a positive childhood experience. Second, we support, like Mandy mentioned, supporting communities. And in particular, one thing I haven't mentioned as much about yet, but is we fund a lot of organizations, 12 currently, to collect data on adverse childhood experiences and positive childhood experiences. Because as it turns out, it really helps all of us to have better insights and information about what's happening, right? Are things moving in the right direction, the wrong direction? In which communities are we starting to see some improvements? And then trying to figure out why, right? What are the things that we're doing that are working to help continue to grow that evidence base, right? So that we know more of what works and for whom. And that leads to the third, which is really working with partners to share that information about what works. And I'll give an example from North Carolina. Actually, Melissa, when Mandy and I were in North Carolina, we worked very closely with our Prevent Child Abuse North Carolina chapter. I remember every year going out to plant the blue pinwheels, in April. And one thing we did with them, with some CDC funding as well, as an educational campaign, and we really tapped into and partnered with our faith-based leaders who are such trusted messengers in the community, and had over 700 people who were trained to support the program in the larger community. And all of that is about how we at the federal, state, local levels, community partners can work together to support positive childhood experiences. Jeff, I would actually love to ask you the same question around federal partners and what's our role and how's ACF doing that partnered work?
Yeah, thanks, Charlene, and thanks for all the great work that CDC is doing. And one of the things I love about this conversation is we're going from one end of the continuum about how we show up as better parents and people in our communities, all the way to, I think, Melissa, you mentioned kind of the big P policy changes. So I want to just talk about some of the big P policy changes we're doing at ACF, and one of the big levers I have is to make regulatory change to make our programs work better for families and communities. And so right now, I think this administration, the Biden-Harris administration, is carrying out what I think is kind of a historic human services regulatory agenda. So I want to talk to you about just some of those things. First is a couple months ago, we finalized a rule to make childcare more affordable for families by capping parent copays in the Child Care Development Block Grant Program. We talked a lot about concrete and economic supports that families need. Childcare is a huge one. We also finalized another rule to eliminate barriers for grandparents and other kin to become licensed to provide care for children in the child welfare system. That knocks down a barrier and acknowledges that we shouldn't treat grandma the same as we would a stranger foster family, right? And that's another way we can get concrete economic supports into those kin caregivers' hands to care for children, keep families together, and keep children within their communities. And we're also about to finalize rules that will improve the Head Start program by paying teachers a living wage and further integrating whole family behavioral health supports into Head Start. And another rule that will guarantee that gay and transgender children in the foster care system have safe placements. We know that outcomes for those children are among the worst that we see in young people. And we also want to leverage our grant programs to promote and support coordination across systems. So for example, tomorrow I'm going to be visiting a grantee here through our Family, Youth, and Services Bureau who has a homelessness prevention innovation grant. This is the first time we've funded prevention in the homelessness space, which will include the ability to provide flexible cash assistance to young people before they're in the crisis of homelessness. And we also know that resources in communities can be really limited. And so we want to take advantage of every single penny that we're able to wring out of Congress for this work. And so in the past 2 years, we've approved over 40 state prevention plans under the Family First Prevention Services Act, which importantly opens up child welfare entitlement funds for states and communities to support families with parenting and mental health and substance use disorder treatment needs. And we're going to do more and more to push that money into communities and get it where it's needed. So those are some of the kind of big P policy changes that are top of mind for me and that we're incredibly excited about. So now I want to take the conversation away from our federal bureaucracy speak, acknowledging that we're really important partners in this work, but I want to get back to the folks who are kind of closest in working with kids and caregivers. And I think we've heard a lot of acknowledgement that parents have this key leadership role to play in promoting positive childhood experiences. So Sandy and Paul, I want to get your perspectives on how organizations can better center the experiences of caregivers to involve them in key decisions and really share that power with families and caregivers.
Yes, thank you for that question, Jeff, and amazing to hear about all the policy work that is happening, and congratulations as we all continue to work on this really important topic. I think one of the keys in what we do is engaging directly with parents and caregivers authentically. You know, I think I'm proud to say that the American Academy of Pediatrics, we've been working to expand our work to those who have lived experience in the child welfare system, for example, including birth parents. We want to incorporate their experience and expertise into all of our guidance and the work that we do. And by partnering with those directly who have been impacted by the systems, the programs, the policies, including the big P policies, we're better able to tailor what we create and the work that we give, and also to improve the healthcare that we deliver as pediatricians. We need to continue the work to promote optimal and accessible solutions. Pediatricians, we're all over the country. We work in many settings. We see families of all types, you know, as far as whether, you know, all socioeconomic levels, different geographies. There are pediatricians all across this country, and family physicians and nurse practitioners and PAs. So many people who provide healthcare to children. And it's really important that we continue to work with those who have lived experience so that the care that we delivered is informed. I'm so thrilled that so many of my colleagues here represent organizations that do this work. And I think us continuing to work together is key. Supporting safe, stable, supportive relationships is probably one of the most important things we can do as caregivers, clinicians, service providers, and policymakers and parents. So thank you.
And for me, to that question, I'm going to say, take away the shame. Hear the voices as they speak directly to the needs of the child and family. Make the necessary changes. Build better. Give what is needed and not just what is mandated. And finally, again, I say, make the resources available, accessible, and known.
All right, well, I know we're coming up to time, but I have one last question for Valerie and Melissa. You know, what's one thing quickly that you want clinicians, parents, caregivers, educators to take away from today that they can do to support thriving families?
Yeah, I just want to say positivity for all ages starts with kindness. So if there is one thing that I want you all to walk away with, please be kind. Be kind to a child, be kind to a family, be kind to parents and caregivers, be kind to your community. Melissa?
I love that, Valerie, and it's so aligned with what I wanted to share. Parents, all of us, we love our children, and none of us parents alone. We need each other. My children will do better if all of our children are doing better. So it's really that simple, right? Care for a newborn baby, you know, give parents some help, some support, call a friend, right? Phone a friend. Really, really important.
All right, well, I'm going to close this out here, and I hope I speak for everyone on the webinar that I'm just feeling incredibly inspired and buoyed by this amazing group of folks who have had the honor to join today. At ACF, one of the things we say is that when you do this work, you need to find opportunities to kind of fill up your love cup. And I feel like my love cup has been really filled up by all of you today. So what I'm just very grateful to have joined you all today. So in closing out, I want to just go back to where we began, which is, you know, just wanting to encourage everyone, and hopefully you've had kind of a litany of possibilities here to identify one thing you can do in your own family, in your own community, in your own job, whether that's today, tomorrow, next month, or next week, to promote positive experiences for kids. I also want to tell you that the partners on this call have developed a resource handout with additional information, many of the resources you heard today, including practical tips. And as we talk about accessibility, that resource is available in English, in Spanish, in Arabic, and in Mandarin. And you can find that handout and a recording of this event on the ACF Behavioral Health webpage, which hopefully someone is dropping in the chat momentarily. And I just want to say, on behalf of myself and Dr. Cohen, we're going to continue as partners and teammates in this work. We're going to continue to expand this work to really use the science and get evidence-based resources to prevent ACEs, to promote positive childhood experiences out into communities. And so we plan to hold additional learning opportunities for grant recipients and other partners this summer and into the fall to continue highlighting these existing resources. And additionally, I want to let everyone know that we're very pleased to announce that the 24th National Conference on Child Abuse and Neglect will be held April 1st through 3rd next year in Rockville, Maryland. This conference is sponsored by our Children's Bureau, and it will be the first time it's been held in person since before the pandemic. And the conference theme is doing things differently, believing in communities. And so we're excited to bring together professionals, parents, youth, and others who are invested in family well-being for this event. So hope you'll save the date for that and look for more information on how to participate from the Children's Bureau soon. Again, thank you all so much for what you're doing every day for kids and families in this country. Thank you to the amazing panelists. Paula, I think I'm going to go home and do your camping game as soon as I get back from Alaska. And again, thank you all for just filling up my love cup today. And I wish everyone well, and we'll see you soon.